Cass has, on any given night, over 800, pushing 900 people who are staying in our shelters. We're best known for the shelter in the downtown Phoenix area that is a congregate style shelter with 600 people in it on any given night. Now, last year, we got about 9% of the people coming to that shelter into permanent housing. So a relatively low percentage, but a very high acuity population. Because there's so many people that come to that facility, 9% actually is about 300 people getting into permanent housing. That's a pretty big number. Here's the problem. At that shelter, we have 4 full-time case managers, meaning for 600 people, we cannot get nearly most of them on a caseload. We don't have the ability to go and reach out into that shelter. So what we're saying is we already have this. What enhancements can we make that will have a major impact on homelessness in our region? Let's say I took that 4 case managers to 10 case managers. We intentionally engaged every single person in our shelter early and consistently. And over time, not overnight, we drove that number from 9% to 20%. Our community would, on the same scale, get 365 more people into housing just from that tweak alone. So what I'm looking at is, given the realities, the grim realities of finances within our state and our local communities, what are some of the places where we can concentrate resources to have the most bang for the buck in solving the problem? And one thing that shows success consistently is when you engage with people regularly and intentionally, you help them get access to the resources that already exist in our community, and they resolve their homelessness. So if we weren't to add any more housing, which we need to badly, and if we weren't to add any additional resources to our system, if we could just add more intentional engagement with the property managers that are already there, with the clients that are already being served, we could boost our outcomes. And so that's what we're focusing on at CAS, is preparing ourselves to find what's working best and build on that.
I want to go now to Mayor Woods, which thank you so much, because it's a big deal to have you here today, and I appreciate your leadership. So I want to ask you, Mayor, what lessons have you learned from leading the city, as you've done so well, through really a complex housing crisis, homelessness issues? What do you think is valuable to be speaking about today about what you've learned?
I think the biggest thing is that there's not any one single approach that will actually solve the entirety of the issue. We've had to address this from both the housing side as well as trying to address unsheltered homelessness at the same time. So when I think about the unsheltered homelessness portion, we've actually over the last few years doubled the number of people who are going out and working in that homeless outreach and prevention area, otherwise known as our HOPE team. We also have a Care 7 group that actually works with people who are experiencing mental health challenges, and many times those groups are actually co-locating to make sure that we are actually having them kind of sync up as much as possible, because while they're not always dealing with the same clients, sometimes they frankly are. We've actually spent a lot of money in the last few years, too, acquiring multiple shelters in the city of Tempe to make sure that we are adding additional housing for folks who frankly need it. I should also note, too, that our shelters allow pets, because we all know that that's one of the biggest issues that a lot of people have talked about. I would frankly want to get off the street, and I'd want to try to find a way to stabilize my own situation. But if I have a dog or I have a cat, which is pretty much, as we all know, a member of our family, I'm not going to leave a member of my family behind when I go into the shelter. And so pretty much from our perspective, it really is doing everything we can on that side, but also our Hometown for All program, which is trying to find ways to create more affordable and attainable housing options for people living in our community. Many so they don't become homeless in the first place by kind of falling into a downward spiral because they may have had a life situation cause them to lose their job for an extended period of time, perhaps some kind of a healthcare issue. So I think it's a matter of trying to do it from both sides. It's trying to do everything you can to address unsheltered homelessness, but also making sure that you're creating more attainable housing for people who need it. And I should also say, lastly, it's also making sure that you're relying on your community partners. We might be a city government, we have plenty of resources, but we don't have enough resources to serve everyone in the city of Tempe or even throughout the entire valley. So it really is critically important to have partnerships like the one we have with CAS and a lot of our other nonprofits and faith community groups, along with residents who frankly want to step up and help us as well.
Mayor, do you think that we can make real strides here in Arizona? Homelessness is one of those issues that's sort of a broad brushstroke, right? It's complex. But what Nathan's talking about here is very specific solutions, case management. Do you think we have the ability here in Arizona to lead the way on this subject?
I 100% do. And I think conversations like the one we're having today with so many people from different backgrounds and different walks of life sitting around the table, all kind of focused on the same goal, is exactly how you have that kind of collective impact that you need. So I have no doubt that Arizona can be a leader in this issue. And I think this conversation is a great start.
Thank you so much, Mayor. And I will pass it down now. I want to go to Tad. We have several prestigious healthcare leaders here today, but Tad, the mayor was talking about the pet issue, and I know Mercy Care has leaned into that to try to help families protect their pets. You guys have done some great programming. So I just wanted to ask you about Mercy Care. So you insure tens of thousands of Arizonans, including many experiencing homelessness. I want you to lean into this right now and talk about sort of your thought process as you sit around this table today.
Yes, thanks, Carrie. And again, thanks to everyone, all these amazing thought leaders here at the table. It's very exciting to see what can happen with folks like these at the table. Just a little quick background on Mercy Care. So Mercy Care, local nonprofit here in the state of Arizona, covering almost over 400,000 lives. These are individuals that qualify for the Medicaid program as well as Medicare at times. And these are individuals, the vast majority are living in poverty and or have pretty significant disabilities. And what we have found over the years, which is not very difficult to come to this conclusion, when you have housing instability, it is very difficult then to manage your health care. And so the impacts of individuals having chronic illnesses, their abilities to access preventative health care become almost to the wayside because those individuals are really focusing on housing, trying to find a place to sleep, not the healthcare and sometimes the really critical healthcare needs. Getting those addressed does not happen. So what we found is that is paramount. Housing is healthcare. When we give someone a place to live, not only are we giving them dignity, but we're also giving them health. So that is a key piece to this. The other thing, we are actually in a fortunate situation with Arizona where many of the support services, the really critical services, not only do we need affordable rents, we also need to tie that with support services, critical support services. And we are fortunate here in Arizona under the Medicaid program, many of those support services are actually covered. And so when we tie those support services to affordable rents, we see success. And at Mercy Care, when we have support services in place, 99% of those individuals stay housed. That speaks volumes to if we get affordable rent and we tie those with support services, we get success. So that is what we have found. And we've also discovered you can't do it alone. We got to collaborate. We got to work together. This problem is challenging, but we have great minds here in Arizona, and people like this at the table coming together will help us solve the problem.
It's the collaborative process. How much do you personally care about this, Todd?
I will say immensely. So I spend much of my time professionally dealing with the social determinants of health, such as housing. I have stated to others, and I'll say today, I have a very personal experience to this. I have had loved ones struggle with housing. Just most recently found a loved one that was homeless for quite some time, discovered them in another state, and we're now getting the wraparound services put in place. And so seeing it from both the professional lens as well as the personal lens drives my why I'm sitting here today.
I have told you this off camera, and I'll tell you this now on camera too, that I just think that to hear a leader like you speak into that space and say that out loud is going to help so many people. So thank you so much for that. We'll move the mic now over here to my partner here next to me, Jordan Brose. So you've built an incredible law group. You're an amazing philanthropist and leader in this community. I just wanted to ask you, just from a personal perspective, why was it important to be here today?
I so appreciate being here today. I appreciate what Cass is doing for our community and the fact that you have sitting around the table elected leaders, thought leaders, major businesses that all want to solve this problem and be Arizona leads in the solution is just incredibly inspiring to me and something I want to be a part of in any way I can. Nathan, your leadership at Cass has been phenomenal, and the way that you approach this problem and all the different multifaceted complexities that are there are, I think, will allow for other states at some point to point to Arizona as this is what we should be doing. And we can all, in our travels around the country, think of places that you wouldn't want to emulate in this respect. Mm-hmm. And I think the way that you're thinking of this as an innovator is really tremendous. And it's exciting to be here at this time to solve really what is one of the greatest issues of our time.
And Jordan, one final question for you, because you're an attorney, you're a solution-driven person. Do you see the ability here? I mean, just even looking out today and with Nathan's leadership, do you see the ability for Arizona to actually put forth solutions that could lead in the nation?
I think absolutely. I mean, there's a couple things, when you see others who have come before you and have failed, that's really helpful because you cannot make those same mistakes. And then when you see people who have innovative ideas about situations and things that we can do to solve the problem, and you can combine those all together to move forward, that's where solutions happen. So the fact that we're open to creativity, that our leadership here, both elected and business and Nathan and Cass, are all trying to work together to learn from the past and to come up with a new future that works is really exhilarating.
And then finally, just on a personal note, why do you care about this?
I care about this because, we're involved with housing, with the community, and to look around and see people who have had a sliding door of life that haven't necessarily been as fortunate as all of us sitting here for whatever reason, and to be able to look at those people and try to help those people to maybe have a new sliding door that creates something happy and a joyous life is really something I means a lot to me.
Thank you for all the work that you do in the community. I mean that sincerely. Like, you do a tremendous amount of work. We really appreciate you being here. And we'll move the mic now over to Gil, and we'll stay on the healthcare topic here for a second, Gil. So your role focuses on equity, right? So when we have this discussion about homelessness and how we help more people climb out of homelessness, and we talk about affordable housing, we talk about mental health, can you lean into this space with me and say why you care about this?
Yeah, definitely. Thank you, Carrie. Well, we know that people of color, our American Indian individuals, are disproportionately affected by homelessness. And that has to do with many factors, right? Like policies, zoning laws that affect individuals getting affordable housing, obtaining affordable houses. I was just recently, it was just kind of new to me to figure that out, but find that out was that some of the assessments that we use to assess a person's need for affordable housings have racial biases on them. And so we are seeing that our Black and Latino individuals score lower on those tests. So that affects their chances to get affordable housing, obtain affordable housings. So yeah, so there's definitely a equity issue with regards to housing when we see those populations that are more severely affected by homelessness. And we also see that those health outcomes Tad spoke about. Housing is healthcare. It is healthcare, right? We know that a person that is housed is going to have better health outcomes. We know that our homeless members die younger, suffer chronic diseases, infectious diseases, mental illness, substance abuse issues, all because of being in the streets and being homeless and over a period of time, right? That just affects their health outcomes, and then their struggles obtaining health care, right, also has negative health outcomes on our homeless populations. So it means a lot to me, equitable care, right, and making sure that everyone has access to health care, but not only access to health care, but affordable housing, right? It's key, affordable housing, in order for them to be successful.
You're another powerhouse leader in the healthcare space. Do you see an opportunity here with the things that we're talking about today, with what Nathan's putting forth with Cass? Because a lot of folks in the public, you hear this issue. It's like, wow, there's homeless people. We're overrun in our neighborhoods. It's just like in a revolving door here. Do you see the ability to put forth solutions at this moment in time?
Yes, definitely. And Tad mentioned it, right? It's all about collaborations. We can't do it all by ourselves, right? We have to collaborate, unite forces, because what you bring to the table, I might not bring to the table, but I might bring something that might be beneficial, right, to the cause. And so I think that's key. I think that we need to have the discussions and then come up with the solutions and what parts we could each play to end homelessness here in Arizona.
Gil, thank you so much for that incredible insight. And on that topic, I want to move over to Jorge now and talking about your work with the Navajo Nation and what Gil was just saying, how it relates to this subject. Jorge, and thank you for being here.
Well, thank you. And thank you for having me again. I'm proud to speak for the Navajo Nation or on behalf of the Navajo Nation when it comes to homeless or the unhoused, but all the other tribes. The first thing that I noticed a long time ago, that a lot of our citizens that are unhoused under our bridges in the riverbeds look like they're Hispanic, Mexican. They're not. Many are Tohono O'odham, Apache, Navajo, and they're down here for the things that we think, oh no, they're coming from cold weather because Arizona's nice weather. And we have a little bit of a stereotype around that. And that's true. But a lot, disproportionate of what we're seeing that's unhoused are our Native American citizens. And they're also, one of the sad things that when they pass, a lot of times because they may not have ID, they look at the body and, okay, Mexican, Hispanic, and we're even misidentifying that. And so I've gotten to see that over 25 years, just, real close at hand. And so, and my heart breaks. You asked Gil earlier, what drives you in the morning? And for me, a couple of things. When to whom much is given, much is expected. And I think that, and I want to drive and lead and with that in my life and gratitude. And how do we give back? And specifically, we can close our eyes, throw a dart in Native America, and we will find need. And that's true for, the mayor spoke about Tempe, and I know Tempe well. And so what drives me, what I see for Native Americans, and specifically for Navajo, is that it is so rural. It's rural to rural. And so when you have 60% of the population, and you heard that right, 60, without running water, without electricity, still today, and I'm not talking about a country in Africa, I'm talking about 4 hours drive here in Arizona. Again, it just breaks your heart. And we look at housing. One of the things that, Carrie and I have talked a little bit offline is in housing. Well, if we try to do a shelter, say in the Navajo Nation, where you just heard, we're going to run into trouble with where's the power, where's the water. And if we want to do a self-contained building, our construction costs go from $500 to $800 a square foot. If you try to build something small, a 700, a 1,000 square foot, housing unit, we're talking about $500,000 to $800,000. The math doesn't work. And so great companies like Exhale, Kevin's company, doing great work with telehealth, telemedicine, part of the solution, of course. And then it's been said over, and it bears repeating, it's a collaborative process. There's no silver bullet to this. It's all of us hands-on working and just continuing tenaciously, because I think tenacity is a superpower and we just never give up. And using that as a superpower, collectively we can continue to move towards, solving, but certainly making a dent in the problem.
Kevin, since Jorge mentioned you, I'd like to turn it over to you now to just talk a little bit more about your work in this space and leaning into the solutions and what you see we can do next specifically.
Well, thank you, Carrie, and well done, Jorge. And I do have to say something real quick. I met Nathan about, I don't know, a couple of years ago. I was just talking about you this morning and yesterday. And the reason why I was talking about you is because I was telling these individuals, I've never seen a better run operations than at Phoenix Rescue. It was unbelievable. So Cass is very lucky to have you. The state is, and definitely the population we're talking about right now. The way that I look at this, and I was born and raised here, and I have this is very personal to me, but I'm gonna cut to the point. We have very passionate, selfless service people here, very knowledgeable. But what is the real problem aside from people being homeless? The real problem is capital. We don't have capital, right? We were just talking, earlier today. If you're going back to a bank and continuing to ask for more money after failing year after year after year, you're not going to get that loan. You keep going back to the government. I need more money. You're not going to get the loan. So what happens? We have capital that dries up. And we have to really look at this with a business mindset. And if we don't, we're going to continue losing that money, and we're going to continue seeing more and more people on the street. So the approach that I've taken is very selfless. It's a selfless service model. And I really hope that more companies can do this. But if we are able to be honest and let people know what our operating overhead is, what our margins are, and give a little bit of that percentage of the margin back to these nonprofits, to CAS, to the state, to the municipalities, then that can turn into an evergreen fund. And we can manage and become a steward of that own money and decide where that money should go. Now, on telemedicine side, if you're working with a tribal nation or an FQHC, the margins are considerably higher, significantly higher, 2 to 3.5x. So me personally, I don't need all that money. I mean, a lot of people would like to have that. I don't need it. And there's a lot of really great people out there that have the same opinion. So take 20%, take 30%, take 50% of that and give it back to the people that actually really need it. Until we see more of that, I think we're just going to see more and more people ending up on the streets. The other point that I want to make is, again, I've been here my whole life, and I've worked with pretty much every behavioral health company and operator there is in the state. I can tell you right now, we have the infrastructure. We have the infrastructure. We have the service operators. With telemedicine, we can stretch far beyond Arizona throughout the country and get those case managers, get those providers. So our human capital is not just here. It's also throughout the entire country. I was giving Nathan, we met, not too long ago, and I was giving him an example of what we're doing. I guess what we're doing with the Navajo Nation and what we should be doing down here. We have Connections Health Solutions. We have Southwest Behavioral Health. We have CMS. We have all of these amazing operators that are running seamlessly. You have an individual that's on the street, it's 180 degrees out, and they're going to fall, hopefully not, and get second, third degree burns. They need water, they need food, they need bed, they need air conditioning. Who has that? It's not just CAS, it's Connections Health. Take that person there for 24 hours, 48 hours, they'll get treatment. They're not going to hurt themselves and somebody else, hopefully, and then move on. What's next? Axiom Health. Take them to detox recovery. They're there for 7 days, 14, 21, a couple of months. Guess what? That's food, water, bed, air conditioning, and services to help whatever's going on in their life, whether it's substance use disorder or mental health. So we have the systems here, but what the operators need to be doing, and they own it. They know this. They have to be talking to each other. They have to be talking to each other. And so I think we need an umbrella management system that works with all the service providers, law enforcement, ambulatory, and bring in a telemedicine company. It doesn't have to be Excel Telehealth. It can be anybody, but that's an easy way to keep tabs on individuals and to perform a psychosocial at CAS. Figure out what's going on. Okay, you need to go to Connections. You need to go to Southwest Behavioral Health. Right there, it starts right there. And getting other companies involved like Circle the City on a mobile crisis response aspect. So until we have, I think that two things. One, the umbrella management system where referrals are just ongoing. The second one is the business leaders in this community have to look and tap into their margin. They have to. We can't keep going back to the government, the city, the state, because guess what? They don't have any more money. For the most part, guess who does? The private companies. So use a portion of that money, turn it into an evergreen fund, and just keep it going in perpetuity.
Kevin, thank you so much. And Representative, when we finish here, I'm going to close out with you because I know you have some specific points that speak to what Kevin was just talking about. Now we'll pass the mic down to Steve Zabilski, which I'm so honored that you're here today, a major nonprofit leader. Piper Trust, long been a leader in strengthening Arizona's nonprofit human services. I mean, the list goes on and on. And so I just wanted to ask you why it was important for you, sir, to be here today.
Well, thank you, Carrie, very much for your kind words. When you look around the room here, I mean, these are the leaders, these are the people, Nathan and Cass, and what you all have done for so many years. I think, Nathan, you said 17 years, if I'm not mistaken. And we look at the situation today and we realize it's not good and it's not where we want it to be and needs to be. But if you step back for a minute and said, what would it be like if these leaders weren't here? You don't even want to go there. So, but the Piper Trust is one of the organizations in town that has looked at this issue of homelessness and housing, and where the trust has really dedicated its efforts and its dollars with regard to homelessness is on the prevention side. Because while Nathan is working so hard to get the hundreds and hundreds of people, out of CAS and into housing and moving on with their lives, the unfortunate thing is at the same time, for every person that comes out, 1.2 people become homeless. And so the trust has tried to move upstream to prevent that from happening. What can we do to reduce the number of people from becoming homeless? And oftentimes, Carrie, the issue can be just a few $100s. This doesn't need tens of thousands of dollars and all types of intervention. And in some cases are complicated, there's no question, but many of them are simply, here's a single mom who got a dead battery in her car or a flat tire or lost some of her overtime hours or there was a medical issue and she can't pay the rent that month. Well, any of us, if we knew that, would step up with our own money and pay that rent so that woman, that family, those children don't become homeless. And that's where the trust has really tried to put its energy and its effort and its research. It's capital. Kevin, you talked about capital. This is a capital problem. You're right. This is a capital problem. And you're right. We can't keep going back to the representative and say, we need more and we need more. That is not the solution.
Thank you so much for being here. And we'll go down to Bill now. And Bill, I just wanted to ask you, as both a neighborhood business owner and the board chair of CAS, nothing insignificant there. What do you feel about the discussion today and the role that you play in terms of housing, the affordable housing crisis?
At CAS, one of our issues, we have 600 people every night. We're full every single night. There are people at CAS who could be in housing, but there's not housing available for them. So instead, they end up staying in a congregate shelter longer than they need to, which unfortunately then also means somebody sleeping on the street right outside doesn't have a bed to come into. And that's all just because there's not enough places for the output, So we need, and it often comes down to, there seems to sometimes be this break between shelter and housing as if you have to choose between the two. And that has to not be the case. You need both, because without housing, shelter doesn't do anything except just keep people somewhere for however long they stay. So there needs to be that expanded number of places for people to go after they come into CAS. And, I will say, but I also want to make clear one thing that for me that is so wonderful about CAS is we had, I think, 9% permanent housing placements last year, I think was what Nathan said. One of the things for me that I love about CAS is we still care as much about those 91% people who didn't make it as we do about the 9%. And we are, in a lot of cases, the only place that those people can go. So, my opinion, no matter whatever happens, no matter what else we're able to do, CAS is going to need to be there because there are always going to be fresh people entering the system, no matter what we do with prevention. Obviously, prevention is extremely important, but there's always going to be people entering that system, and you always have to have that rescue, that safety net there for them.
So, Representative Liguori, to have you here sitting next to me, I mean, you're someone who can move the needle. You have power and influence. So I just wanted to find out from you, like, how do we align state policy with some of the things that we're speaking about today?
Yeah, that's a great question. I think it's at the heart of what we're conversing on today and what everyone around the table has talked about. So the two biggest things I like to leave people with is one, we have to connect the dots. We have to connect the dots between policy and advocacy and community. And all three of these things have to be working in tandem together. We can make policy changes, but in isolation, as Mayor Wood said, there's no one solution that will do it. So we need philanthropy. We need business. We need all of our partners on the table. Connecting those dots is super important. We also need to connect the dots between housing and homelessness, understanding that homelessness is a housing issue, and housing is directly tied to, as we heard today, healthcare. It is directly tied to education, and education results in children having that stability. It's directly tied to environment. It's directly tied to businesses. We're seeing that in Arizona very severely, where we have schools without teachers and schools with lowering enrollment, restaurants like this not being able to hire staff. It's estimated that if we don't address affordability in the state, it comes with a price tag of $36 billion. In lost revenue and wages that we're having. So there is a direct financial impact to business too. And so I really appreciate that all the voices at the table wholeheartedly believe that, are working on that, because we are all going to have to row in the same direction when we come on this. It's consistency. I know we love the C's here. Consistency, creativity. How do we operate in a financially scarce space, federal government and state? Creative. And then how do we coordinate and collaborate better? And I think if we can really all work together on those four parts with all of these organizations around the table, we will be able to help alleviate one of the things. Housing is dignity, stability, and health. And I know that no one else sees that more directly than Nathan every day when he goes to work. And I know that we all see that in our communities and the people we see on our streets and in our neighborhoods. They're fighting for all of those things right now.
My goal here for today was, again, selfishly, to learn from some people that I knew would have some really good things to say. And I've absolutely done that. So if you're thinking about the perspective from someone like Gil working in health equity, who says, I'm identifying these inequities in access and outcomes related to healthcare among Black, Indigenous, and other people of color, that is something that's incredibly valuable. Our tools and our systems are sometimes disadvantaging certain groups of people. To think from a business perspective that there are people out there who understand the scope and scale of the problem and say, like Kevin does, it's incumbent upon me as a business leader to take some of this margin that the people in our community have helped me attain and to put it right back in our community. Those are the kinds of things that we want everyone out here to be seeing, to think of a foundation that has a head like Steve, who's worked in this space and can therefore bring an important perspective that says it's time to move our resources upstream. And I could go on and on and on about the people on the panel here. There are some really valuable things that don't often get said in these rooms because we brought in people who are not always in the room together. And again, I would just reiterate that for Cass, we are putting ourselves in position, doing the boring behind the scenes work to make sure that we're ready as our community is ready to invest and to put our dollars in places that make the most impact, that we are ready to handle that we're ready to build on that, and that we will be able to produce great outcomes for the most down and out members of our community. So honestly, thank you all for being here. Selfishly, again, I learned a lot from you and we'll be applying that. And Carrie, thank you so much for doing this with us.
I'm a friend to you. This gentleman right here is an incredible CEO, and that's why I'm sitting here today, honored to help facilitate this roundtable discussion amongst all of the best leaders. And I mean that from the bottom of my heart, the best leaders in our community sitting around me today. So I'm Carrie Pena. Thank you all for joining us today. This is a roundtable discussion about solutions to try to bring more people out of homelessness in a dignified way, brought to you by Cass.